Thank you, Team Adidas. I was really surprised that the application already, the website already prepared. But in Team B, we also have prepared a great slide of the unique program. So could you please start the presentation, Yosuke?
Okay, so can you see my screen?
Okay, great.
Okay, so let's start our presentation. So Mika-san, let's start. Go ahead.
Okay, let's start with Team B's presentation. All of our team members will take turn to present our project for public health. Next, please. Our team's name is Bright Bluebird. The meaning behind this name is that we all have a bright perspective and help patients. This bright bluebird will also bring happiness, love, hope, and warm heart to all patients and their families. By the way, the illustration of the bird was drawn by our mentor, Mr. Ozaki. We have discussed various projects for our metaverse world as a Bluebird Medical Center. Please listen to it. Next, please.
In our team, we divided public health into three perspectives: prevention, early detection, and mental health. We will talk about the impact of COVID-19 on each of us. Next slide, please.
Cancer is leading cause of death in the global. Cancer screening is an effective preventive measure that can reduce cancer incidence and mortality. While cancer screening is integral to cancer control and prevention due to COVID-19 outbreak, many screenings have either been canceled or postponed, leaving a vast number of patients without access to recommended healthcare services. The cancer or postponing cancer screening may not adequate to avoiding cancer diagnosis, but delayed cancer diagnosis could lead to increasing mortalities. And also the COVID-19 make the changing lifestyle and healthcare actively. The vaccination also effective to the people, not only COVID-19 vaccine, but also other vaccine protectable disease. So the COVID-19 threatened to delay vaccine, for example, because of the lack of access, shortage of vaccine and vaccine hesitancy, overwhelmed healthcare setting for delivery, which affect the people and makes the people feel difficult for prevention of the cancer. Next, please.
Okay, just as Hong mentioned, about early detection, there's also delays of this part. And there's a study in UK that has shown that as a breast cancer, for example, in the trials, there's about 9% increase of additional death for three different scenario groups, according to this study. And about Taiwan's data, the prevalence of cancer is diagnosed is rising because of aging and unhealthy lifestyle, and especially during these 2 years of COVID-19. And the data from Health Promotion Administration in Taiwan, compared with 2019 and 2020, there's the decrease rate of about 23 and about 15% of public cancer detection in 2021. So I think it's universal critical phenomenon now. Okay, next slide.
I will talk about the negative impact of COVID-19 on mental health. COVID-19 caused a very high level of fear and anxiety in all people. Here, I would like to share the experience of a cancer survivor participant who is on our team. In urban areas in Japan, many people use public transportation. He had been riding trains and buses wearing N95 masks and goggles because he felt he was at risk of infection due to his weakened immune system during chemotherapy. We healthcare providers are also under constant stress as we have to be careful not to become a source of infection in our daily lives. Next, please.
We focused on mental health, in particular within public health, because in this COVID-19 pandemic situation, there are patients who are isolated. Telehealth systems, including the internet tools, enable anyone access services and anyone connect with other people equally and safety. Impact statement. Bluebird strives to enable readily accessible public health care for cancer patients, their families, medical workers, and communities of all backgrounds to make their journey brighter with peace of mind through telehealth. Next, please.
Our team vision statement is enable anyone to overcome the fear of cancer with peace of mind anywhere at any moment through telehealth services. Next, please. And the mission statement is build a metaverse telehealth platform, Bluebird Medical Center, in which anyone can access services about early detection of cancer, prevention of cancer, and mental health. Through this mission, we can provide easy access to providing supporting programs for everyone, including patients, healthy people, and medical staffs. Achieving our mission leads to our vision by reducing anxiety of cancer patients. Next, please.
Let us introduce why telehealth. To avoid COVID-19, easy to learn, at your own pace, immediate feedback, tailored lectures and guides, assurance and trust, private. Next, please. The metaverse is a perfect fusion of physical, augmented, and virtual reality. The metaverse is a public virtual world that may be accessed via the internet. It increases our virtual world experience by simulating humans' emotions and gestures. We can exercise in gym, enjoy music to relieve our stress, check our health, learn healthy recipes, etc. We will build a Bluebird Medical Center on Metaverse to improve public health. Because we can keep privacy, we can access better learning resources, relaxation resources with 3D virtualizations. We can interact each other without limit, and it is really attractive. Next, please.
Now let's move on to our project for public health. First of all, we classify the project into 3 points. Because public health is not only for cancer patients, but also a healthy population and healthcare providers. Next slide. And I'll talk about a healthy population, especially based on prevention and early detection. Next, please. As you know, we are facing serious health issues around the world. According to WHO, non-communicable disease kill 41 million people each year, and NCDs include cancer, and the number of deaths is 9.3 million. And WHO shows that tobacco use and physical inactivity, the harmful use of alcohol, and unhealthy diets all increase the risk of dying from NCDs. Next. As we said earlier, we provide the multiple service at Metaverse. In addition to this, if we rely on artificial intelligence, we can provide more enhanced intervention. One of the biggest advantages of AI is that it can increase accuracy and precision. Depending on the situation or type of person, it is able to provide accurate information about cancer, or we can connect local hospital if we need to see a doctor. Furthermore, AI is not affected by any unconscious bias. Next. And then also behavior change is important to prevent cancer and early detection. In the real world, usually government or local administration manage to our public health, but it's too hard to make it fun, especially for kids. As you can see on this slide, if we introduce the game function or collaborate with the game company Nintendo as an education tools that children or younger generation can enjoy, and they could be show their interest in health population. Next. And then lifestyle related disease is also the risk of cancer. And one of the important things that we deal with to improve health promotion. It also, if we use AI, it can provide personalized care, and it's the key to behavior change. That's it.
In addition to supporting the healthy population, we came up with a project to support cancer survivors, the 32 million around the world. Next, please. Even though cancer has been controlled or cured, cancer survivors still may suffer, whether it's anxiety, deconditioning of their body from treatment, stigma, discrimination from society, body image change, and more questions, even questions that they did not even think of when first being diagnosed with cancer. Next, please. So for our cancer survivor telehealth support project, it is comprehensive, starting from the diagnosis, during treatment, all the way towards post-treatment, throughout the whole journey, not only for patients, but as well as family and caregivers. Next, please. The BBB Health Cancer Survivor Support is comprehensive, focusing on wellness, the mental health, but also physical health, which could cause anxiety as well. Some here includes anxiety, depression, worries about work and education, worries about appearance, fertility, family cancer risk, nutrition, exercise, and even vaccinations besides COVID. The solutions would be specialized medical specialists, such as an oncopsychiatrist, or taking advantage of AI and metaverse technology platforms. Shiho will talk about mental health support and Shinzo about physical health application examples. Next, please.
We built BBB Salon to help improve the mental health of cancer patients, survivors, and their family in metaverse. Use chatbot to provide live information about treatment. Check their mental state by AI or sometimes by mental health specialist. Provide coping service such as peer support, online counseling, relaxation program, appearance care services. Next, please.
We all know that mental health is well related to physical health. So we also offer projects to improve physical health for cancer patients and cancer survivors. You can book a personal trainer in the metaverse of BBB Gym. That a personal trainer could offer you tailored exercise program according to your cancer type and according to your cancer status. And you can also exercise with other cancer patients and survivors in the same virtual room as well. Next slide, please. We also offer BBB kitchens that all cancer patients could share their own recipe of healthy food, the cooking procedure, or sharing their healthy food experience with other cancer patients. We also have the online nutritionist could offer the most accurate food information for all cancer patients and survivors. Next, please. In order to further improve their health, we still offer health counseling other than despite cancer treatment, other than cancer treatment. We have the pregnancy plan, we have the genetic counseling, we also have vaccination plan. All this information could be easily accessed. Next.
Okay, I'm going to show a presentation about projects for healthcare providers. First of all, we focused on the importance of well-being of healthcare providers. According to the declaration from Japanese Nursing Association, nurses should try to improve their own well-being to perform high-quality care for patients. So, we aim to all healthcare providers involved in Bluebird Medical Center to be prepared to stay healthy both physically and mentally, and to do their best to support the health of patients. We propose these contents for healthcare providers. The first is to make Bluebird Medical Center a healthy organization, and the second is well-being program for healthcare providers, and the third is international digital book for healthcare providers. And the additional content is to conduct a clinical trial and make a new evidence for healthcare providers. So let's see in details. This is about the first one. All healthcare providers in Bluebird Medical Center can receive information from the director about the policies and revenue of the center and kind messages which motivate them. And they can receive education programs about communication skills and manner training. And the center does not overlook inappropriate behavior to the staff. This is the second content about well-being programs for healthcare providers. Anyone from any country can join this program. They can share their experience and feelings to each other through online interaction salon. And we provide programs about exercise, meditation, yoga, relaxation music, and also provide programs increasing the oxytocin levels in which they can see a kind scene or heartwarming story. We want to screen depression or sleep disorders and consulting physicians or counselors before they burn out. I'm sorry, but my screen. We propose international digital book as a third content. Digital book includes the patient's medical record, past test results, and medications. Any providers who get consulted can access it and view or edit information about patients who have registered the service. Translation function is equipped with the digital book, and the patients can choose someone who will understand their culture as a consultant. Doctor to doctor or staff to staff consultation system are also included. This is an additional project for us. We want to conduct a clinical trial to emphasize the importance of well-being of healthcare providers. This is just a rough idea, but we will randomize the healthcare providers into two arms. One will get our well-being services and the other will stay as usual. We will evaluate quality of life or ratio of burnout and consider the efficacy of our well-being service. There is a problem that lots of healthcare providers feel a high level of fear due to the COVID-19. So we want to give happiness for our patients and their families by improving well-being of healthcare providers. In summary of our projects, Bluebird Medical Center can provide bright programs for healthy people and cancer patients or survivors and medical providers.
In conclusion, Bluebird Medical Center is an institution in metaverse that provides cancer prevention and health promotion at any time, at anywhere, for anyone. Especially in these periods of the COVID-19 pandemic, and especially for those in the toughest time. Recently, some nations are suffering from extreme violence, and we Bluebirds appeal to immediate stop of war and back to peace. Our platform will open to anyone in any conditions for their easy to access. Also, TeamA Editor is also, we sincerely invite you to join our plan. This is our whole members, and thank you for everyone for dedicating into this plan, and thanks for every tutor, every mentor for your instruction. Thank you.
Oh, thank you for great presentation. 10 minutes ぴったり. Okay, so let's have a question or a comment from the audience, please.
I saw that Tony may have the specific question.
Yeah, Tony.
Yes, please see the chat box.
Okay, I saw you have specific tutors and mentors support different parts of your project. Did the idea come from participants, tutors, or mentors? How did the support impact on your team project development?
Our projects mainly from our team members and sometimes supported by tutors. So mainly our members made our project.
Yes, Tony, they divided 3 groups in considering the different parts of their project by themselves. Yeah.
So when they divide into small groups, the tutors and mentors will support them separately, or?
Yes, separately.
Okay.
Yeah.
So I think that's a good way.
Yeah. So but the big concept of the group, I mean, making the impact statement, vision statement, mission statement, they all get together, discuss the statement, and after that they were going to separate 3 groups to create a project, and the mentor and tutors also divided 3 groups to support, I mean, the 3 lines.
Okay, thank you very much.
By dividing our team, we can hear the great opinion from each member. It was very easy to hear from all the members.
I want to share my experience during the project development. It's very special experience, and thanks to JTAP, arrange cancer survivor in, I think, everything. And I think it's definitely increased the diversity of our team members, especially thanks to Binzi's offer his point of view many times that is quite different from medical providers. And actually, parts of these ideas are provided by cancer survivor members in our team.
Yeah, Busy. Do you have any comment?
No, this was just a great team. I mentioned to them, I've had an opportunity to be part of a few teams. This team really worked. Actually, perfect example, because there's people from Vietnam and also Taiwan. TED, we were making it as a whole team. I was on the survivor subgroup and Ted is in another subgroup. He created our slide for our survivor openly. And so it was just pure teamwork. It was just wonderful. It was amazing. So even that last few minutes, like, oh, what should we talk about? And we were just talking about other. So it was a great experience of diversity working together. Yeah. So I was very grateful to be part of that. Yeah, hopefully for you and everybody reminds the survivor is part of the team in your medical care. But yeah, I'm proud and grateful. So good job to the team and mentors. And
thank you for your comment.
Hi, I wanted to make one comment, and actually, I think that was a great segue. One of the questions I was going to ask TeamB was if any of the members had ever worked on a project with a cancer survivor before, and I think you all summed up, your thoughts on that perfectly. In that, oftentimes we're asked to work on initiatives or projects that have direct impacts on patients or their family members, but we often don't always ask them how the projects and initiatives that we create actually impact them or for their input. So I think one statement I wanted to make was, I think this is a great example of, as we move forward and once you leave JTOP, the workshop, keep in mind with a lot of these projects who the end result is impacting. And I think there's a lot of resources out there, and don't be afraid to reach out to some of these resources that have cancer survivors that could actually help you guide any projects you have, because at the end of the day, they have insight that if we have not gone through that, we don't understand. So I think that was a great discussion, and for all the teams, really important to keep in mind. So thank you all.
Yeah, thank you so much. So any comment from the audience?
Dr. Ozaki, I have one question.
Okay.
Okay. So, did you feel psychological safety in your team members? So, what kind of attitude did you like?
So anyone can respond to the question. How about Megumi-san?
just to add, honestly, even now, I don't know if we even decided on an official leader. Our team, it was an interesting thing. Yosuke informally, and we were just, I don't know if we officially decided a leader. And so we really worked together. I was amazed by that. Actually, later I was like, okay, we're just flowing as a team. Yeah, or I missed that.
We naturally come together and naturally gather with the open mind. So we try to support each other as much as possible. Even I'm working in palliative care unit, so I'm very busy. But all our members supporting me to do, even on mobile phone. We make the sub group by the line. We keep in touch by line. So every people try to open their heart and ready to support each other. So it's naturally come together.
Actually, at the first time, there is a problem about barrier with language difference. Yeah, so we try to use two languages, including English and Japanese. And someone who can speak and who can understand English will translate it and to make our understanding more easier. So yeah, so we can use English and Japanese. That is a very good, nice work to proceed our project.
It was great. Thank you very much. You are all very supportive. Thank you.
Yeah, thank you for questions. And the team B overcome the English, the language barrier and diversity of culture and experience and age and country. And they made a very high performing team to develop such a unique project in this presentation. So we mentor and tutor, and we are really proud of support your team. So thank you all. So we finished our presentation. Thank you.